Good morning, everybody. And today we had a very interesting topic to discuss here at Tzu Medical Foundation. My name is Peter F. Chen, MD, FACS, with 40-some years of the surgical practice and GI endoscopy. Currently, I'm a volunteer physician at the clinic and also in charge of the Healthy Community Program. And today the subject we're talking about cancer is a very interesting and also is a very boring subject. The thing we know about cancer, the thing we did not know a lot of cancer. So we like to explore try to get as much new information delivered to the audience. Hopefully, we people, after today's discussion, we get a better understanding of this boring subject. Now, according to the World Health Organization in 2018 cancer report, there is about 17 million new cases of the cancer around the world. About 1/3 is strongly related with the tobacco smoking. Practically, that is the cancer is the second cause of the death in the world. About 9.6 million people died of cancer. Now, also the same statistic, they'll tell us what is the most common cancer cases around the world. In the male, the top one, of course, the lung cancer, followed with the prostate, colorectal, stomach, and also liver cancer. In the females, number one number is still the breast cancer, followed by the colorectal and the lung, cervical cancer, and thyroid cancer. You will see the amount, the case more common, number 4 than number 5 case of the world, a little bit different than United States, the cancer sequences incident because of the health care issue. Now, according to the statistic, in the United States, each person in a lifelong with the invasive cancer risk, the men is a little bit higher than women, but 20 years ago, practically every 3 men and every 2 women we had the invasive cancer in a lifetime. But now the women become catching up. The male currently is about 42.5, the 0.5%, and the lady with 37.58% chance to get the invasive cancer in a lifelong. That means every 1 out of 2.378 men, 1 out of 2.66 women will get the cancer in a lifetime. Now, according to the 2020, the newest one, the new cancer rate, you see and compared to the 2014 report, which I had previously, and a little bit different. Now, in the main, the most common cause still the prostate, followed by lung, colon, urinary bladder, and melanoma of skin. Women, still the most prevalence of the cancer is still the breast, followed by the lung, colon, and the uterine, and the thyroid. But the mortality from the cancer is the lung cancer still the top on the list. Now, for the immunology is concerned, we try to project cancer death. All the cancer in the United States, the death rate is coming down, except the pancreatic cancer, which is almost 80% cancer death. And according to the statistic, the trend of the pancreatic cancer, we're going up and up. Pretty soon, it will overshadow the breast cancer and colorectal cancer. For the colon cancer is concerned, that is coming down, incidence also coming down. But according to the report of the Georgetown University report, young cancer, so-called young cancer, that means colon cancer, developed before 50 years old, young cancer, on the way right. We did not know what happened. Could be the lifestyle change and also diet change, etc. I think we try to explore that. That's why. So some people recommend to get early check, especially begin to 45 years old for the young colon cancer. In average, the colon cancer in average age is about 67 in the United States. Now, in the what's the difference between the cancer, top cancer, and cancer death, the world and the United States? Now, look at that. On the screen on the left side, this from the WHO report. You see the number 4, number 5 is the prostate and stomach cancer. But in the United States, number 4, the 5 is colon cancer and bladder cancer. So, what you see the difference? You see the number 5, the stomach cancer, because of the hygiene, the knowledge about the cancer, the knowledge about the H. pylori, and never eradicate, etc., will cause this going up on around the world. Now what's the difference between this, the United States and the world? Now you know that the world, the cancer death, the new cancer is about 17 million, with the 96 million people, the cancer's death. That means the cancer death ratio is the 0.56. But instead, in the United States, about 18 million new cases, but cancer death only 600,000. That means cancer death about 0.335, as compared to the world 0.564. Is quite in advance, and hopefully we'll keep it up. Hopefully the world will also catch up, so they cut down the cancer death ratio. The 5-year survival in the U.S. The last 5 years is about 67%. Now, what is the normal cell? We're talking about normal cell. The cell grows every single day and gradually grow and damage and deprivation of the oxygen, eventually die. This we call the apoptosis. That is a normal process. Okay, that's every day, every minute we go through that, and we will not know it. But what is the abnormal? We get millions of the cells division every single day, but we do not know what the factor come out, the cancer factor, the damage normal mitochondria and the repair process. So when you develop the changing of the mutation of the gene and the escape from the immunity system and all other factors, they grow more rapidly and disorderly and progress become cancer cell. Now in the lower part, you will see the picture from the normal cell to the gene mutation to the escape immunity and gradually develop cancer cell. But to this stage, the cancer cell doesn't mean too much, because practical people over 50 years old, we harbor certain amount of the cancer cell in our body, but they did not cause you any problem unless something happened, like for instance your lifestyle change, your immunity system different, and continue to have the damage factor, and they will assist the cancer grow, and gradually they grow and grow to a certain amount that because they need the nutrition about 3 to 5 times more than normal cell, so they need a lot of new blood vessel so that they can deliver the nutrition to them. And then when they get the metabolism from them, they produce a lot of toxic material that will further damage our own body. So this is when to the certain stage, they begin to invade the organ and causing damage to the organ, and further they move to the different part of the organ we call metastasis. That is a problem to start with. Okay, so that hopefully we can do something to let this minute amount of cancer cell in our body become hibernated. That's our goal. Okay, That what's a cancer formation factor? About 5 to 10% is from the genetic. There's nothing much we can do about it. Okay, the life-wanting familial adenopolyposis, the BRCA1, BRCA2, and the Lynch syndrome. This all linked with the gene, our genetic, because our parents give us to Earth. Nothing much we can do. But if we know this, we can do a lot of one big step, one forward to take care of it or take it before it turns out something else. Remember that the movie star, the Jolene, the Angelina Jolene, and they get both breasts removed because what? Because BRCA1. Because the 8 or 9 family, very close family, all develop either breast cancer or female cancer or ovary cancer, etc. So he prophylactically removed their both breasts. I don't know what is good for her or not. We do not know, but it takes a big courage to do that. So same thing that familial adenopolyposis, you get millions of polyp in the young people. They start to become teenagers. So when you get 20 years old, we'll begin to screening this. And then we'll see that when it begins to change, to the mutation begin to change of the polyp, we try to recommend to get the whole colon removed before it turns out to be cancer. If we not do it, about when up to 40 years old, he would definitely develop colon cancer. That is something we can control ahead of time. But 90 to 95% is environment. That's what we're talking about. This is not only your lifestyle, not your socioeconomic situation, your behavior, and the etc. That will cause all the problem. Now, most for the environment factor, which we can take part in charge of it, to try to change it, to alter it, so we get a better living. The most 3 common causing the cancer. Number 1 is a diet. We know that we don't want to get too much diet. We don't want to get too rich the diet, and that we can do it. You know that in Taiwan, the number 1 cancer is a colon cancer, and why? Because the people eat out 80% of the time. So not necessarily outside eating is no good, but a lot of the so-called processed food is really not good for our body. And the diet, number 1. Number 2, tobacco smoking, causing about 20-30% of the cancer. And obesity, causing another 20%. Of course, alcohol abuse, certain infection, and especially like H. pylori, we cause stomach cancer, Hep B, Hep C, causing the potentially causing a liver cancer, EB virus causing nasopharyngeal carcinoma, cervical papilloma will cause the cervical cancer. All these things that we know that we can take care of it, we can prevent it further causing end up with a damaged skin. Of course, very important. The important is the aging process, because we all getting older, we get much more chance to develop cancer. But nothing much we can stop our aging. But we changing the lifestyle, hopefully we can avoid the cancer. Now, very important, we try to stress today, how do you get the parents' awareness? Try to remember that a lot of symptoms come maybe every day we experience 1 or 2, maybe we didn't pay attention to it. But if this continues to a certain period of time, you better do something. Like for instance, without any reason, you fatigue all the time. Without any reason, you suddenly weight loss. Make sure it's not diabetic. And then, of course, the other thing can cause weight loss. And then sudden change your GI symptom, GI problem. And suddenly you feel the area should not have a lump, a bump, and something show up. And you suddenly become anemic. And also the symptom of the anemia, tide, etc. And suddenly you see blood in the urine, blood in the stool, and the skin color change. For instance, your sclera, they become white, and also chronic cough and chronic fever. All these symptoms, bring you to the time to see a doctor so that they can find out is anything significant wrong, so he can catch it and they do it before anything else. Now we talk about, now we go one step forward. We're talking about this cancer therapy. We traditional, when I was in medical training in 1960 to practice until 1970, there's the most common we know is because we know the cancer grow very fast, so we need a surgical to remove the cancer. We get chemotherapy and radiation. But remember, I'm a surgeon. I'm very reluctant to ask the people to do the surgery unless absolutely necessary, because surgery itself is a trauma. You can cause your trauma. Yes, you can eradicate the pathology, but at the same time you get a lot of damage to your own body, especially immune system, unless it's necessary. The chemotherapy radiation is look like you're shooting the buckshot, and you kill the bad people and also to kill a lot of good people too. They cause a lot of damage. So now since 1970, the so-called target therapy with monoclonal antibody therapy begin to come in the world, and it gets much more targeting. Use antibodies, the targeting the cancer cell, the surface, the protein, so we can catch it, so we can kill it, or we can deal with toxic substance to kill it, or we can bring it to the red flag so that our immune system can go attack it. We call it target therapy. And later on, the last few years, we had a so-called the escape immunity therapy, cell immunology therapy, like CAR T-cell, carmichael antigen receptor T-cell. We use a patient body own T-cell, and then we get genetic antigen receptor to infuse it to the cell so that it can grow to multiple. When with this carmichael antigen receptor can recognize the cancer surface, the protein, so we can catch it and kill it. That is much more promising, but it's very expensive. Okay. The other supportive treatment, of course, the integrated Western and Eastern medicine, we strongly favor the body, one body supposed to be taken care, not only physically, also spiritually, also the body, etc., etc. And the spiritual therapy is also very good. Traditional Chinese therapy, that is all very supportive therapy, will help the individual patient. We get stronger in immune system, nutrition system, so that we can control the disease. Now, for the what kind of tests the doctor will do? Of course, when you go to see the doctors, you will completely history. Make sure you tell the doctors everything you remember. Also, tell all the family, your first degree family or second degree family, in the past, what kind of disease they had. Hopefully, the more complete your history, the doctor is much more easy to make a judgment much more accurately. Of course, in the lab test, you can do the complete blood test and metabolism test, and also you can get the cancer index, you can check the stool, urine, etc. This is very simple. If a doctor finds something wrong, they will recommend to do some radiology, X-ray, ultrasound, CAT scan, PET scan. Of course, PET scan is very expensive. It's good for follow-up of the cancer therapy. The other one, arteriogram, the blood vessels, but arteriogram is very important for the liver cancer and before the surgery, and also the pancreatic cancer before the surgery. The isotope on the thyroid, 131. Endoscopy is the one, the tube, like you see on the right-hand side. You can do which of my specialty was in the GI endoscopy. You can check the esophagus, stomach, and small bowel, part of small bowel, and whole colon checkup. And the nasopharyngeal for check the larynx, the bronchoscopy check the lung, bladder can check the cystoscopy check bladder. They can find out any lesion, any abnormal appearance of the tissue. They can obtain some tissue for the diagnosis. if necessary, if that the physical history meet, sometimes we might need the bone marrow or gene examination. That is very rare, but it might. Now, fighting against the cancer is the only way, according to, you see, the WHO, NCI, American Cancer Society, they had a consensual opinion is the one. Several points. Number one, early awareness of cancer detection. We mentioned it before. To get medical advice, seeking the appropriate treatment. Also, early change to the healthy lifestyle and the diet. We're going to talk later on. And try to stay away from carcinogen and also environment. And also remove the precancerous pathogen if you find it. Like for instance, situation at COVID-19, we cannot avoid when we go out. Now make sure we get a mask, make sure hand wash, etc. Took adequate precaution. The same thing when it comes to the environment. If they get too crowded or too dusty, put a mask on, and you can protect yourself too. Now, nothing I can stress more important for the cancer awareness. So, according to the National Cancer Institute, American College of Surgery, and Society of American GI Endoscopy, which I'm part of it, and recommend, I try to pick few the cancer topic to talk about the screening. Now, probably the most common ones of colorectal cancer, we recommend 50 years old begin to do the colonoscopy or flexible sigmoidoscopy plus the fecal occult blood test. Yeah, if that is a negative, that you do every 5 years. Once you get a positive, I really recommend a full colon checkup. So I myself rather prefer do the colonoscopy first and then do the flexible sig rather than flexible sig. But remember, we just mentioned that some scholar recommend, because of our young colon cancer coming out, we recommend between 45 years old begin to screen this young person. For the breast cancer, with almost a century, that we recommend when you get puberty, begin to check your cell breast. The only you check 1,000,000 times, you know how's your breast feel, and then you can identify something when something coming wrong. But when you're 40 years old, make sure if you're going to do the mammogram or ultrasound or MRI. In Chinese population, usually we do MRI, ultrasound more than regular mammogram because our breast tissue is a little bit dense. Now, for a prostate cancer, it's very interesting. We recommend 50 years old begin to do the PSA and the digital rectal exam. It will surprise the African American. The people in Africa, their cancer of the prostate is much lower. For the second generation, third generation United States, the African American, the prostate cancer is going up higher and higher. So we recommend that when they're 40 years old in United States, for African American, begin to start to do PSA and also direct rectal exam at the age of the 40. Now, for lung cancer, of course, the best screening test is still the low-dose CT of the chest. For the people, the recommended for the people between 55 to 75 years, or you smoke one pack of cigarette per day for 30 years. We call it 30 pack years, okay? Or you quit smoking less than 15 years. And this we're talking about no symptom, okay? So they get lung screening. For the liver scanning, we recommend people hepatitis B and C or cirrhosis liver to get every 6 months. They get ultrasound of liver and liver function test, and also the alpha fetoprotein to make sure you detect the liver cancer, because lung cancer dying is 80% death. Liver cancer about 70%, very high. For the cervical cancer, we recommend when you're age of 21 years old, begin to do pap smear regularly by a gynecologist. When you get over 30 years old, hopefully we can do, especially the sexual, a little bit the active lady, you get more, make sure you get a human papillomavirus test, and so that we can detect anything change early. We can eradicate the cervical cancer much earlier stage and much better result. Nothing. I want to talk about the healthy lifestyle, which will change we will change the cancer, not only regular healthy living, and also can cut the cancer rate, etc. This is published by the Public Health Service of the Harvard in 2016. They recommended called healthy lifestyle 4 points. Number 1, absolutely no smoking. Number 2, reduce alcohol consumption to the men for the 2 cup a day, and women no more than 1 cup a day. And maintain the BMI between 18.5 to 27. Of course, this is American, but in Oriental, I think it should be, I'll adjust it from the 19 to about 25. Hopefully maintain this healthy BMI. And then maintain adequate exercise, mild to moderate exercise, at least 30 minutes a day for 5 days a week. Okay, these are 4. I myself add 2 more things. Number 1, healthy diet. Number 2, reduce unnecessary emotional burden. When the people problem, don't worry about them and worry about yourself. Overstress will definitely detrimental to your health and also your immunity system. Okay, look at this chart. The obesity, I did not know it will cause so many, related with so many cancer, from the meningioma to ovary cancer, from the esophagus cancer to the pancreas cancer to the stomach cancer, gallbladder. Okay, we're surprised, huh? And tobacco, look at it. Originally, we think the tobacco only affecting the lung, but not necessary. It affects a lot of things. It affects from the throat, the vocal cords, and also the kidney. Surprisingly, urinary bladder, colon cancer, pancreas, and also acute myeloid leukemia. We're surprised. I think that's so. Can you stop smoking, please? I myself stopped smoking in the United States since 1968. I used to smoke 1.5 pack a day before I come to the United States. I stopped it in the first day in the United States because I did not have the money to buy it. Okay, good food. A lot of food in the grocery store had a lot of the cancer fighting. They are fighting the cancer a different way. Like either they block the tumor growth factor, or they block the blood vessel, we call angiogenesis inhibitor, and also directly causing damage to the cancer. There's a lot of cheap and good stuff in your grocery store. So this is very good for you. And of course, this majority are vegetarian. Also, we try not to eat overcooked food, no over-polished diet, and also the like for instance, a lot of the preserved food and fried food, deep fried food, barbecue. Once in a while is okay, but not all the time, please, because it got potential harmful to you and potential your family. So in conclusion, the same thing I try to summarize it. Number 1, cancer is not contagious, but it causing pathogen, yes. Like for instance, liver cancer is never contagious, but hepatitis B, C, the virus is also contagious. The liver cancer is not. So adopting the healthy lifestyle and the good food will stop the cancer survival, and also good healthy food, and also stop the cancer growing. Be aware, early exam, like we said, early detection, early treatment always have better prognosis. We need not only that, find mental support, we need to encourage, never give up to the patient, and also provide a cancer survival is a much better and quality of life. Don't give up yet, because the cancer is not deadly disease. We, at least in the world, we are the most deadly disease is death itself, right? So it's much more deadly. So the cancer right now, at least 12 million of the people, maybe among you, among your family or friend, live with cancer. So never give up. All right. Now we go some the program for upcoming for the spring with English health education and from the respiratory disease, heart disease, lung cancer, and colorectal cancer. I'll be in charge on the colorectal cancer. We get more detail talk about anything related with the colon cancer. I hope the people will enjoy this and enjoy it. And then we had this the Q code. You can get it. Also the telephone number that you can call, and you can copy this down and call us if you need it, and so that we can get in touch with you. You are very welcome to this program. This is my family, and we went to the Cabo and every single year, Christmas time, New Year time, except this year. And I really appreciate your attention. Hopefully, I would like you get a feedback, because today we do not have Q&A. Really the most interesting, which I'm very fond of it, is the Q&A, so we can communicate in the both direction when you had anything we consider. That's the end of our talk. I will really appreciate that, and I hope that you all enjoy the simple talk. And of course, my English is not that fluent, as much clear, but at least I tried to deliver the message as clear as I could. I thank you for your attention. Thank you very much.